Good morning, Las Vegas, and welcome to A Healthier Tomorrow. I'm your host, Will Rucker, and today's show is packed full of amazing information that you need to know, information about your health and about our community. So let your friends, your neighbors, your family know A Healthier Tomorrow is on the air. We have two amazing guests that they will want to hear, so spread the word. Let them know that we are on. The Healthier Tomorrow radio program is brought to you by the Office of Chronic Disease Prevention and Health Promotion at the Southern Nevada Health District. Discover beautiful walking and biking trails in your own neighborhood with our Neon to Nature program app. The app can be downloaded for free on your Android or iPhone device. So go ahead right now and download the Neon to Nature app. Community Partners for Better Health is dedicated to educating our community about the things that matter, about our health, so that we truly do have a healthier tomorrow. Visit us online at communitypartnersforbetterhealth.org and find out more about what is happening with our programs and our initiatives, in addition to what we are doing here on the A Healthier Tomorrow program. And with that, let's welcome Andre Wade, who is the State Director of Silver State Equality. Good morning, Andre.
Good morning. How are you?
I'm doing well. Thank you for asking. And I want to thank you for joining the show today to address this very important topic. It's still one that unfortunately has way too much stigma, but because of the work that you and others are doing, we are starting to make movement and to really get this, as we'll say, modernized. You taught me that earlier. So with that, I just want to open it up. And if you could share a little bit about your work with Silver State Equality.
Thank you. And I always enjoy it when progressive, mindful folks like yourself have these conversations with the community at large. So thank you for opening up this space. Silver State Equality is a statewide LGBTQ civil rights organization here in Nevada. We have the mission to create a world that is fully just and equal for all LGBTQ Nevadans and our allies, so people that support us. And we do that by passing poor equality legislation, getting poor equality candidates elected to office, and doing some advocacy and education work. And so we have a C3 and a C4, meaning a political and sort of advocacy arm. And yeah, we've been around for 2 years. We have 13 members on our advisory board, including some legislators. Been doing some great work with our partners. And so, yeah, just have a lot going on with the legislative session happening right now.
Before we even talk about the bill, can you explain to the audience the difference between what you're attempting to do by modernizing and what I've heard so often, which is decriminalizing?
Yeah, so great way to start it off. So HIV criminalization is a term that we use to describe these different laws that states have that criminalize behavior that's otherwise legal. But because you have HIV, you're living with HIV, it's a felony involved. Or if someone living with HIV commits a particular criminal act, instead of it being a misdemeanor, it becomes a felony. So what that means essentially is just because someone's living with HIV, they will have a felony enhancement at times. And so we're just trying to get it to where it's not a felony enhancement. Whatever happens, it's just going to be a misdemeanor. It's treated like any other communicable disease. And so decriminalization just implies that we're trying to make it to where these things aren't criminalized at all, and that's not what we're at. We're just trying to get it to where HIV is treated just like any other communicable disease. So we're trying to modernize our laws.
Okay, well, thank you for sharing that. It does make a difference with, as we've learned, with the way that you phrase it can really influence the way that it's received. So I think that's big. Now, you mentioned that the group you're with works primarily with LGBTQI individuals. However, from my understanding, the largest group living with HIV is actually Black women. Is that still the case?
Black women are the third largest group. So As far as heterosexual Black women, are a growing number of those who are living with HIV and having these high rates of new diagnoses. And so they might not be the largest overall, but they're a really large group compared to other populations. And it's not something that people would otherwise think of. And it's unfortunate because at the end of the day, you have the Black community, the Black populations that are mostly affected by HIV. And it's something that's been happening for decades now that we still need to continue to address.
Okay, and that makes sense. So aside from men who have sex with men, that's where Black women are number one.
Correct.
Okay.
Absolutely.
And I just want the audience to hear that because, again, sometimes this comes off as, well, that's just something that's a gay disease. Even in 2021, I still hear that, but I want our audience to be very clear. This is something that impacts our sisters, our aunties, even our mamas. So it's important that we are all on board with addressing this. What else can you share about the work that you're doing? What does the bill? What do you hope to achieve with this bill in Nevada?
So back in the last legislative session, Senator Parks introduced a bill, SB 284, that created this task force to look at laws that criminalize HIV in Nevada to modernize them. I'm on the task force. I'm the chair with Senator Harris as the co-chair, and there's 14 of us total. And so we've been looking at the laws to see where we need to update things, because there's things in the law that references AIDS, like transmitting AIDS, but you can't transmit AIDS, you transmit HIV. It's just like you can't transmit COVID, but you transmit the coronavirus. So just having to update things like that in the law, but also trying to update it to where it's not those felony enhancements that we talk about. So right now, the way the law is written is that someone can be charged with a felony if they're living with HIV for biting, spitting, or scratching someone. And what we know is that you can't transmit HIV by biting, spitting, or scratching someone. So why would someone not only get a misdemeanor charge, but simply because they're living with HIV, that it's going to be a felony? But if that same person was living with hepatitis C or the coronavirus or any other communicable disease, any other disease that's transmittable, it's only a misdemeanor. So HIV is only called out. And I'll just give people a quick rundown of what happened in our legislative sessions back in 1980s and 1990s. This is when these laws were put on the books more than 20 years ago, when we knew very little about HIV and AIDS. And so there were these conversations going on in the legislative session about how can we criminalize people living with HIV to prevent the spread of HIV. So if someone's living with HIV, they thought there were these super spreaders, these prostitutes, these horrible, sinful, despicable gay people that were spreading this disease intentionally. And that's probably the key, is that people were thinking that it was being spread intentionally. And so they were like, well, if this is happening, how can we get folks off the street? So we find out that they're doing this, we're going to give them a charge of a felony. So they will get fined for up to $10,000 and be in prison for up to 10 years. And so for the past 20 years, we've had these discriminatory and homophobic laws on the books. And there was a guy that was Dr. Cameron, who came and testified to our legislature about these laws needing to be on the books. And this is a guy who had been discredited by the American Psychological Association, the US Sociological Association, many statewide sociological and psychological associations, and even a group in Canada. So even though that had already happened, he used his harmful and misinformation to present it to our legislators back then. And in a sense, the laws that were passed. And so we have been living with these laws for 20 years. And so that's why this legislative session and what happened the last session with the task force being created, we're trying to undo the damage. We're trying to say, okay, that's what y'all thought 20 years ago, which was inaccurate, but hey, we were dealing with the information we had. But now that we know more about HIV and that it's not transmitted like people think it is, we need to update our laws and take away the stigma. And so that's kind of how we got here today is like dealing with the misinformation, the harmful information from 20 years ago.
That's big. And I didn't even realize where that stemmed from, but it makes sense because when you don't know what's happening, you kind of react to try to stop it. Just like you had mentioned with COVID, when we first started to see this outbreak, we didn't know what to do. And now that we do know, wear a mask, wash your hands, we don't have to do some of those other things that we maybe thought, like people were boiling lemons in their kitchen, that kind of thing. So we
Right.
don't have to do those anymore. How can people get involved to learn more about this process, your organization, and this work?
They are free to contact me directly. They can go to our website, silverstateequality.org/HIV. There's information about our work to modernize these laws. And I'll also add, if people are interested in getting information about HIV to be just better informed about HIV in general and just where and how to get tested, they can contact me and get them in touch with people like at the LGBTQ Center and the Health District and other different groups so they can learn more about HIV because unfortunately, a lot of people still have a 1980s and 1990s understanding of HIV because there's still a lot of stigma involved. HIV is not the virus that we thought it was, and we just really hope that people can have a better sense of that understanding. It's not a death sentence. It's not something that's easily transmittable, but we just really need a lot of people to have a better understanding of it as well.
Yeah, that's so important for people to hear. It's not a death sentence. People are living with this like any other chronic disease. So let's get rid of the stigma. Let's stop pretending it's still the 80s. We are in 2021. Let's move forward. And I encourage everyone to get involved. Andre, thank you so much for joining the show this morning. Much success to you in your endeavors and all that you're pursuing. And thank you for being an advocate for our community.
Oh, my pleasure. Thank you as well for creating the space like I mentioned before. And I'll just quickly add that Nevada Partners is having an event later in April, I think April 24th. They're doing a block party. And I'll be there with some information. We hope to do some HIV testing. And so if folks want to chat in, they can do so as well.
Perfect. So Nevada Partners is hosting a block party, and I love to party. So I will be there April 24th, right?
Yep, 5 o'clock.
All right. Well, we'll see you there.
All right. Thank you.
The Healthier Tomorrow radio program is brought to you by the Office of Chronic Disease Prevention and Health Promotion at the Southern Nevada Health District. In the US, nearly 9 out of 10 Black smokers aged 12 years and older prefer menthol cigarettes. It's time to say no to menthol. For free help quitting smoking and vaping, call 1-800-QUIT-NOW from a Nevada area code. Again, that number is 1-800-QUIT-NOW. Here with us now is none other than Mikhail Holmes, health educator with the Southern Nevada Health District. Mikhail, good morning.
Good morning, Will. Thank you for having me on. I appreciate it.
Oh, thank you so much for being here. The work that you're doing is so important, and anyone that listens to the show knows that tobacco is a major issue that affects our community in some very real ways. So what you're doing to help people quit using tobacco and create policies and things that support clean air are so important. And we're just, as a community, grateful that you are doing the work.
Oh, thank you. Thank you.
So with that in mind, tell us a little bit about yourself, what you do at the Health District, and why you're here today.
So I'm with the Office of Chronic Disease Prevention and Health Promotion in the Tobacco Control Program. I go out and talk to the community and try to get our people here in Nevada to live a healthier life. I believe in being proactive versus reactive and doing things to help improve the overall quality of life and wellness.
That is such important work. And I get to work with you on a near daily basis, so I know how exceptional you are. So for our listeners and our viewers today, know that you are in great hands with this wonderful individual. My first question for you is specifically about flavored tobacco products. We talk a lot about tobacco, but now I want to bring in flavoring and why there's the distinction. So the question is simply, what are flavored tobacco products?
So flavored tobacco products are any nicotine containing products that also have a taste of flavor other than the traditional tobacco taste and flavor. That includes cigarettes, cigarillos, disposable gels, vapes, cigars. I don't know if I said that, but vape liquids in general is what we're going to be talking about here. And when we talk about vape and the electronic cigarettes, they come in over 15,000 flavors. And most of them
Wow.
are, yeah, and most are like youth luring flavors like bubblegum, blue raspberry, gummy bear, cotton candy. So there are flavors that attract kids in general. And the reason why they put them in there because it masks the harshness of smoking. So flavor has been added to tobacco products way back in like the 1920s. And what it does is just make smoking easier. It calms the irritation and it kind of gives the impression that flavored tobacco products itself is a lot safer than the non-flavor. Unfortunately, that just isn't true because inhaling the flavored products tend to be a little bit more enjoyable for people. So they take in more, and that's more nicotine, leading to more nicotine addiction.
Yeah, it sounds like the flavors make it seem like it's acceptable or healthy even because if we think if it tastes good, then it must be okay to have, but it's
Right.
definitely not. Now, let's go back before we get into the vape and talk about flavored cigarettes because there used to be more flavors available. Could you share a little bit about that?
Yes, cigarettes definitely did come in a wide variety of flavors. But with the Tobacco Control Act, the FDA put a ban on flavored tobacco products, especially cigarettes, um, banning all flavors except for menthol and mint.
So then, Mikhail, why is flavoring and menthol in particular a big issue for our community?
Well, just as simple as flavoring attracts kids. Most kids use a flavored tobacco product the first time they try smoking or vaping. And I think it's actually around about 81% of youths who tried the first time they use a flavored tobacco product. But more importantly, when we're talking about the community, tobacco products and especially menthol tobacco products have been heavily marketed in the African American community. This might not sound too alarming, but what that has been leading to is about 70% of Black youths between the ages of 12 to 17 years old, and about 77% of non Hispanic Black adults choosing menthol products. That is a lot of people, a lot. So, and when you look at the number, it's really 93% of adult Black smokers prefer to use menthol cigarettes.
Yeah, I can
And
tell you that my grandparents, when they smoked, thankfully they've quit. But I hate to admit it, but they would send me down the street with a note, get me a pack of menthols.
yes.
That's what we would do. So when there were more flavors available, was it equally spread out amongst the flavors and menthol just rose to the top? Or how did this one flavor make its way into our present day tobacco use?
Oh, yeah, that's a good question. And if I remember correctly, menthol was the first flavor that was added to tobacco products. And when you think about menthol, you think about the healing properties of it. Your um, throat lozenges, your chewing gum, your toothpaste, all of those items have that minty menthol flavors to it. So it's something that's very familiar already with the public. And so the tobacco industry knows this and they did their research. And, it was probably one of the ones that was most liked by the public.
Okay, so the most popular flavor was allowed to continue, even though the goal of this act was to reduce tobacco use.
Yes, and even today, that is menthol, mint, and candy flavors are the most popular flavors amongst flavored tobacco products, which is really bad because when we talk about African Americans, 45,000 die each year from smoking related illnesses. And African Americans, we have a higher struggle with high blood pressure, heart disease, stroke, diabetes, lung cancer. Menthol also causes a stronger addiction than non-menthol products, especially with youth and especially with the Black population, who odds of effectively quitting is about 12% lower than using non-flavored products. So it's harder to quit menthol flavored tobacco products. And again, I keep going back to the African Americans because they're more likely to try the quitting resources. They're more likely to create a quit plan, but they're least likely to be successful in their quitting efforts. So that's something that really needs to be kind of highlighted, that menthol, although it hides the harshness, it also causes a stronger addiction within the Black community.
Wow, that's a lot. And we've got to do something, and you are doing something. So I just want to say thank you again for the work that you're doing to help our community to overcome this addiction. And I do want to make sure everyone listening knows smoking is an addiction. It's not just a bad habit. It's not just something, you know, people are doing, but it's an actual addiction. And that's why it's so hard to overcome. I also have to take a moment, since you did mention the lung cancer piece, and just say the screening guidelines have recently been changed, where now almost twice as many people are eligible for lung cancer screening. So if you are a smoker or have been a smoker in the past, I highly encourage you to go ahead and see your doctor and get a lung cancer screening, because if you find it early, your odds of survival are much higher, and we want you around a long time. So get screened, get checked for lung cancer. All right, so Mikhail, my next question for you is, what is No Menthol May?
All right, No Menthol May is something that I'm extremely excited about. It's Southern Nevada Health District's expansion of the Center for Black Health and Equity's No Menthol Sunday. This is a nationwide event to engage Black churches and the Black community about discussions on the predatory practices that the tobacco industry has been using, and how menthol and other flavored tobacco products play a larger role in tobacco still being the #1 killer of African Americans. So this will be the very first one here in Nevada, and we're super, super excited. It's going to run in May. It'll go from May 2nd to May 30th. And I will be in the churches each Sunday in May. Yeah, and when I say churches, let me just first say send out a very big thank you to the churches who have decided that they want to be a part of this. They are committed to helping their community. They're saying no to menthol. So I am extremely, extremely happy. And I want to say thank you to Nehemiah Ministries Christian Church, Bethesda Church of God in Christ, First African Methodist Episcopal Church, Victory Baptist Church, and True Love Ministries Baptist Church. We really, really thank you for wanting to be part of No Menthol May and being the first churches to take this challenge. So we're excited about that.
Yeah, and I love that you say the first churches, because listeners, let your pastors know you want something like this at your church because you care about your brothers and sisters in Christ and want them to be healthy as well. So Mikhail will gladly come, and this may turn into No Menthol May, No Menthol June, No Menthol July, and
Yes.
whatever else we have to do to make it happen. But she is available and eager to come. I'm sure of that.
Definitely, definitely. We want this campaign to be as large as we possibly can make it and to run as long as it possibly can. So we're excited about that.
So this seems like a good spot to share with people how to get in contact with your office to schedule this programming. So I know pastors are listening right now too. How do they contact you if they want to be a part?
So I can be reached here at the Health District. My name is Mikhail Holmes, and my email is Holmes, HOLMES, like Sherlock Holmes, at snhd.org. So Holmes at snhd.org, or you can call me at 702-759-0744.
If
Sure.
someone is currently using a tobacco product, smoking or vaping, where can they go for help?
Well, for free help to quit smoking and vaping, they can call the Nevada Quit line at 1-800 Quit Now, which is also 1-800-784-8669.
Awesome. So 1-800 Quit Now, and it's free. And when are they available for calls?
24 hours a day, 7 days a week.
24/7. So anytime you feel like you might be ready to even have a conversation about quitting, give 1-800 Quit Now a call. And I assure you, they will be there to help you. And for those that may need assistance with translation into a different language, they do also provide the service in multiple languages. So there's no barrier. Everyone is invited to call if you have that desire to quit. Now, Mikhail, earlier you mentioned a little bit about flavors, and as we wrap up here, I do just
Mhm.
want to touch on vaping, if you would. What is the difference between traditional cigarette smoking and vaping, and is it better to vape?
Oh, wow. That is a very wonderful question that you just asked me. So, we all know what the traditional or the commercial cigarettes look like. It's the ones that your grandmother or grandfather sent you down to the corner store to get with the little note. So, they come in the pack. Those are our traditional with the tobacco. There's a filter, and it's pretty straightforward. When we're talking about vapes, they are electronic. They don't require you to actually put tobacco in it, but they come with liquid that you load into the actual device. So that's where the flavors come in at. Some are pre-filled, some that you can actually just buy the liquid and add yourself. And no, it's not safer than smoking regular tobacco or the traditional cigarettes.
Awesome. Well, thank you for sharing that with us. And thank you for joining us this morning on A Healthier Tomorrow. I'm so glad we had a chance to connect and to talk and to just hear the work that you're doing. You provided some great resources, 1-800 Quit Now as a resource. You also provided your email and phone for pastors that may want to have you at their churches. And I'm throwing you out there, so correct me if I'm wrong, but you will come and do tobacco education and other things even outside of No Menthol May. So you've really given us a lot to work with.
Yes, yes, I will. And if I'm not one that's physically there, one of our community partners that we collaborate will definitely come in. But yes, you can contact us for quitting resources. We'll be more than happy to help.
Thank you so much. All right. So I want to thank you, our listeners, and those of you watching on KCEP TV, our viewers, for tuning in to today's program. I am your host, Will Rucker, and this is a program of Community Partners for Better Health. We are also grateful for your continued support of this program and for the changes that you are making in your own lives to improve your health, and not only your health, but the health of our community at large, because the little changes we make today do in fact lead to a healthier tomorrow. As I always remind you, you are not just a drop in the ocean. You are the entire ocean in a drop, and what you do matters. So yes, the little changes you are making ripple out and can literally affect the entire world. So until next month, I want you to continue living a healthy life, spread compassion, not COVID, and I will see you right here on the second Wednesday of every month at 9 a.m. Again, thank you for listening, and I'll see you next month.